Hello, my name is Orntos. It's my 4th year as a medical student, and I'll start with how I chose to become a doctor. We all know that COVID-19, right? It all began there. During the time of COVID-19 rotation hit, I wonder every time I'm watching the news about the doctors, I wonder how do all of these people risk their own self? And just for the help of other people like that. That moment I realized, okay, it's my path.
For me, my parents advised me to become a doctor. At first, I wasn't very passionate about the profession I chosen. After entering Etugen University, it was quite hard. I faced many challenges such as exams and assignments and pressures. However, the way teacher taught and they makes subjects more interesting, that makes me study harder and makes me fall in love in my profession.
And when I was choosing a place to follow that dream, I chose Etugen University. For the first time, it felt like I'm in the right place. I'm in the right place. I'm there. It's because the professors and teachers don't just teach, they care. And the classes aren't just about tutoring. They help us see and practice everything we learn. Etugen has many collaborations with Korean universities and Japanese companies. Professors tell us don't just go after money. Your goal is to become young professionals who carry both knowledge and high etiquette into the world, they say. Here we don't just learn techniques, we taught humility, respect, and how to carry ourselves with integrity. That's why 91% of our graduates get jobs in their fields after graduation. In our general medicine program, students complete 6 rounds of internships in hospitals. Etugen University has official contracts with over 100 hospitals, giving students real clinical exposure and diverse hands-on experience. It makes me proud to be part of a university that truly shapes who we become, both as doctors and as people.
We first practice on the mannequins, and after we mastered it, we move on to real hospitals.
In our nursing and emergency training courses, most of our practice was done on mannequins. Our nursing teacher taught us the correct techniques step by step, so I was able to find the vein on my first injection try. This shows how effective the mannequin-based practice is. In emergency medicine, we also learned how to perform sutures and tie surgical knots, skills that turned into big advantages later. Everything we practiced on mannequins felt like doing the real thing. In addition, we used Full Code, a US-based cyber hospital where we treated virtual patients online. It gave us real-time clinical decision-making experience, which helped us feel more prepared for real hospital work. For international students like us, using Full Code is a big advantage when preparing for the USMLE, the United States Medical Licensing Examination, which is required to work as a doctor in the US. From our 3rd year, we started forming our real identity as doctors. During clinical rotations, we were trusted to assist with patient care. Those experiences were truly valuable. For example, by 3rd year, we were transporting patients between hospitals, delivering blood and medical supplies, and joining doctors during morning rounds. Watching patients improve over time was incredibly rewarding. I still remember that during my traumatology rotation, I had to face a real patient with all blood covered and with open wounds and open injuries, open fractures. It was my first time, and the blood absence that I will never forget. The sense of blood covered filled the room. Unforgettable moment of my journey in medical school. Being a doctor means constantly interacting with people, so it's essential to greet patients politely and respectfully. The first and most important step in treating someone is how you approach them. A simple hello, how are you, when welcoming a patient can immediately create a positive impression and build trust. That initial connection is key and has made a huge difference in our experience. Even when we've done part-time jobs while studying, a habit of proper communication helped us to stand out. It gave us an advantage in how we dealt with people. Our university has many strengths. Our teachers are excellent, kind, friendly, and deeply knowledgeable. Some are considered the best in Mongolia. The school even has a swimming pool and fitness center, and students can choose with their teachers whether to swim or to work out. Swimming, after all, is an important skill, so the swimming pool is a great bonus. Another advantage is that our clinical rotations aren't random. We train at hospitals officially assigned by the university. These hospitals treat students professionally and gave us strong academic guidance. In fifth year, we had a surgery course originally scheduled at school, but our professor took us to a hospital surgical department instead. We even observed surgeries in person, something that made a big impact. The school environment is clean, student-friendly, and very supportive. Our cafeteria is one of the most famous in the country, and our student dormitory is considered one of the cleanest and most comfortable in Mongolia. Some say it feels like living independently already.
And finally, I joined a student club, which allowed me to spend my free time playing basketball, playing music instruments, even forming a live music band. Because of this, I am very busy. Before I know, my day is already over.
We try to provide to our country and also try to provide medical specialists in all kinds of field. I'm happy to be join you guys on the next semester, so please welcome to Etugen University.
If you want to grow, learn, and be supported, choose Etugen. It's not easy from the beginning, but it will teach you how to become a doctor. When you join our university, you'll be welcomed warmly by students and teachers alike. You'll never regret choosing Etugen University.
Yeah.